Less than 2 months after South African scientists discovered a new variant of the COVID-19 virus, Omicron, the Health Ministry says most of the provinces have reached their peaks, and Gauteng has officially exited the fourth wave. The country recorded 5,920 cases over the last 24 hours. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal.
Gauteng province has officially exited the fourth wave. In terms of the technical definition of a wave, Gauteng, we can now say officially that Gauteng has technically exited the fourth wave this week. And all other provinces have reached their peaks. All 8 provinces have reached their peaks and are now on a decline. Of note is the fact that the decline in new infections is not a steep decline as was the incline. So this virus rises steeply, but when it goes down slowly. But at least it's going down, and this is encouraging.
While Omicron saw less hospitalization, the ministry warns that the variant is still highly transmissible. Government is still trying to reach herd immunity, which could assist in moving the country out of a state of disaster. One of the plans is to drive vaccination. Despite mobile pop-up sites and festive season openings, uptake was still low during the holiday period. Currently, the vaccination rate is still below the targets set by government.
Our target is still informed by population immunity or herd immunity, which has to be coverage of between 67 and 70%. So that remains of our target in terms of the adult population coverage, at least 67 minimum and up to 70% of the adult population to be vaccinated. Now, that is why when you look at the preparation in terms of supply and in terms supply of vaccines, how the number of vaccines we acquired through purchasing, and also the capacity which we created to vaccinate the sites, the personnel, and all that is available we could have reached this 70% by the end of December. Where we fell short is in convincing the population to come forward and receive the jab.
Government is also working on new legislation that could see the state of disaster lifted after 22 months.
The Health Department and also Justice and COGTA have been given the task by Cabinet to look at other regulations, largely Health Act regulations under the Health Act, and also any other under the other departments. So there's a team which is almost also finalizing that. We will be going to NCCC and Cabinet in the coming week or in the next 7 days. We should be able to report and make proposals.
Scientists also warn that a fifth wave with new mutations could be expected in the winter months. This will tell if the country is moving from a pandemic to an endemic. Hasina Gori, SABC News, Johannesburg.